My name is David Green. I got involved with Seva in 1981. 1981, when I was doing my master's degree in public health at University of Michigan. And Larry Brilliant was one of my professors, and it was through him that I learned about Seva Foundation. At that time, they were doing the Nepal blindness survey. And I volunteered and worked with Seva, doing mainly technical editing on the Nepal blindness survey, and also helping with fundraising. And then I went off and worked in Chicago for a year at the health department, and Seva asked me if I wanted to work with them. They rescued me from the Cook County Department of Public Health, for which I am forever grateful. And so I started working as an employee in 1983, where I helped develop Aravind Eye Hospital and the Nepal Blindness Program. First with getting donated medical supplies and equipment, chief among them intraocular lenses, and then also ophthalmologists who would volunteer to teach modern surgery with an intraocular lens. And the donations of lenses and the volunteers helped bring about a little revolution in these eye care programs, where they could start giving patients surgically implanted intraocular lenses following cataract surgery, instead of the old style of treatment where they would just remove the whole cataract and give thick cataract glasses, which our research showed 56% would lose or break within a year, rendering them blind again. So we started to see that patients would come earlier for surgery, knowing that they could get a much better quality result from the implantable lens. And they came before they were economically blind, when they could still afford when they could still have the money to pay something for their surgery. And that kind of laid the foundation for these programs to start becoming self-financing. And so I worked on developing these programs through Seva, and then in the late 80s, the donations of lenses started drying up, and that's when we looked to make lenses, and that brought about the conception of Auralab in 1992, which manufactures intraocular lenses. So I, along with folks from India, mainly Dr. Balakrishnan and Mr. Sriram Ravila, we looked at intraocular lens technology, and we raised money and set up Auralab in '92, and that became operational in February of '92. Producing intraocular lenses, and that's since grown to be one of the largest manufacturing entities for lenses. I think they have close to 10% of the global market share. Last year, they sold 2.2 million lenses. And then we got into making sutures, because suture cost a lot of money. So for lenses, we brought down the price from $300 when we got into manufacturing. Our initial price was $10, and that's since been driven down to about $2 per lens. And these lenses have the same manufacturing process, the same regulatory approval as any intraocular lens sold in Europe. In '98, we set up suture production. I helped find the right guy to work with, Rolf Spengler, and again, that was through a uniquely Seva connection. There was a Grateful Dead fan, a Deadhead, who wrote Seva back in '88, saying, "Oh, we have this friend of ours who we went to a concert, and he lives in Europe, and we think his family does some kind of medical business that can be helpful to Seva." And that was all the detail I had, and this was even before faxes. So I actually sent a letter to Rolf Spengler, and he responded that they would be happy to help, that they make sutures. And so we started corresponding back and forth, but then his dad and his uncle sold the family business to U.S. Surgical, and Rolf was lost to me until 1995, when we again looked at making suture product. So I found Rolf, and he had just stepped down from being the head of manufacturing and R&D for U.S. Surgical. They were about to move the whole factory from Germany to U.S. because of high labor costs in Germany. And so we got together. I went to visit him in Jestetten, Germany, right near the Rheinfall. And we spent a week sitting around his dining room table and hatched a plan to make sutures. And I went about my merry way raising money, and in '98 we got the suture production up and running, and that now produces, I think they have more than 50% of the Indian market for ophthalmic suture. So, and then I continued with Seva. I sort of was the architect in helping the Lumbini Eye Care program in Nepal become self-financing. That was back in the early 90s when Seva was putting up a new hospital. And at that time we introduced cost recovery planning. And with help from Aravind and with the help of our Nepal team, we created a plan to make Lumbini self-financing, which after overcoming many obstacles, was finally implemented in '93 as the new hospital became operational, and that program quickly proved itself to be self-financing. In the first year, its surgical volume doubled from 5,000 to 10,000, and it started generating a profit that was sufficient to cover operating expenses and have a bit of a profit. So that got me on my way, starting to work as a consultant with many eye care programs, helping them to become self-financing. And a lot of those programs, after they reached a certain point of development, I brought Seva in to be working with those programs, and that includes Elnor Maghrabi in Egypt, Visualiza in Guatemala, Kilimanjaro Center for Community Ophthalmology, and I also helped lead the way, getting them interested, along with Aravind, in doing the work with Grameen, developing Grameen eye hospitals. So that's a bit of my history. When I helped develop the Eye Fund with Deutsche Bank, a $15 million fund that provides debt financing, we also developed a grant fund of $1.5 million, and I work primarily with Seva and Suzanne Gilbert and other partners to enable them to be helping other programs. So through 8 training institutions, which Seva has helped develop over the years, we helped them help 37 eye care programs. And in a year's time after the intervention, they had increased their surgical volume by 54%. So my work today with Seva is as a consultant, raising money and help guiding efforts to help make eye care self-financing from user fees, but still oriented towards serving low-income populations. So that, in essence, is a quick history of my involvement.